This amazing dentist, Dr. Nghi Pham, and her awesome team, Mary, Kara, and Tanya, need help. They're doing too much, too many patients, too much work, and I'm thrilled to be interviewing them for our Dentist Job Connect, dentistjobconnect.com platform. They have an associate position in Minnesota. So tell me, guys, I'll start with you, Dr. Pham, why do you need an associate?
Well, we're booked way out in advance, and the next opening is in December. I'm doing dentistry and hygiene, and emergencies are given prescriptions and referred out to either endo or oral surgery. And yeah, we just need help.
So you need a dentist to come to your rescue. Yes, so Mary, exactly. Who's Mary there? Raise your hand. Mm-hmm. That is one of my favorite names. That's my wife's name. So Mary, what is your role at the practice? And tell us a little bit about what's fun about working with your team there.
Well, we just have a great team here. I'm kind of the first face that everyone sees as they come in the door. I kind of help keep everything coordinated as far as time-wise. I guess just kind of keeping everything flowing and helping out where I can.
Answering the phone, air traffic control for a dental office.
Yes.
And in a just be real way, and I'm a dentist, I was at my practice the other day. How does it feel when a patient says, oh, Dr. Pham said I need to do these 3 fillings and you can't get them in for a while? Is that frustrating? Did the patient get upset? Tell us more about that.
Yeah, I mean, everybody in northern Minnesota is pretty nice, but there are occasions where it is pleasant to have to tell them that they can't get in until January. But, we do the best we can at keeping a list, and,
Well, you can always disarm with a joke, say, until they invent a way for Dr. Pham to grow a third hand out of her head, we can only do this. So
we've done that out a few times.
Tell me about, so you're looking for an associate, and let's say I'm applying for this job. Let's just break down some details. Dentists, we're unstable, Dr. Pham. We need to know the details of the details. We need a bite wing of the bite wing. We don't trust anyone. We went to dental school and it mangled our brain. So give us the details. How many days a week would this associate be working for you?
4 days.
4 days. Now, new dentists, I don't know if you've heard, and it doesn't necessarily have to be a new dentist, but dentists who've gone to dental school in the last decade, they've accumulated quite a lot of debt. I graduated in 2002. When did you graduate, Dr. Pham?
1995.
So we're in the same time. So my dental school was $200,000 when I went there. It's now currently $600,000. So these new dentists have debt, and a debt can be emotional. It can be a challenge they think about. So what type of earning potential would I have as an associate with you? How would I get paid so I can pay my rent, eat food, and start paying my debt?
Well, initially it'll be like a daily guarantee. And then for probably, I guess, 6 months or so. And then after that, then it'll be a certain percentage of collection or production based on, what we agree on. So
would it be reasonable for someone to make between $150,000 and $200,000 a year? If you had to give them a $50,000 range, what would you give our audience?
Yeah, I would say somewhere around between 150 to 200, maybe 175, something like that.
Awesome. So an awesome opportunity to learn from someone like you. You have plenty of procedures to share. Kara, what's your role at the practice?
Dental assistant.
So you got to put out the 47 things for a class 2 that nobody appreciates. That's your job, right?
Yep, exactly.
Every time I get my hair cut, the guy hands me the mirror to look at it. And every time I pretend to care and go, oh, good job in the back, right? But our patients, they rip off the bib and just run out of the operatory. They don't appreciate. Tanya, you're a dental assistant too?
Yes.
Very underappreciated is what dental assistants by everyone, especially the patients. So what procedures would the associate be doing routinely, Dr. Pham? Would they be doing restorative, extractions? Tell our audience about that.
Everything. They can do endo, they can do whatever they like. I also have equipment for implants and stuff like that. And we have a CBCT, 3D scanner and 3D printer. I do a little bit of ortho. They can do that if they like. And, traditional ortho or even clear tray aligners. Yeah, just a little bit of everything. I would probably be taking care of the hygiene majority because when I was an associate, I hated hygiene. So I don't.
That's nice, right? You're taking one for the associate team. So you'll take care of that.
I don't want them to think that they're going to be doing all hygiene, because that's not the case. Because I would do the hygiene more so than them. So yeah.
Now let's talk about dentists are people too. Many people don't think we're people, but we're actually people. Okay. I don't know why people walk in and say, I just want to let you know I hate the dentist. I say things like, I just want to let you know you could have kept that in your head. Not always nice to us, right? So as people, tell us about where this job is. You guys live in Minnesota, so just tell the audience, where is it close to? What's the town like? Your time to tell you, Dr. Pham, Tanya, anyone can talk about the area.
Well, I moved here from Houston, Texas, so I went as far north as I could go without leaving the US. We are 10 miles south of the Canadian border. And I mean, I love it here. I came from a big city and to a small rural town, and everyone's nice, they're welcoming, helpful, yes. And so I mean, and there's still things up here for free, you know, like
Nice.
free parking at 2 airports, and you know,
Nice.
and it's just, you know, I mean, I love it here. And you know, we have 2 big industries here, Polaris and Marvin and War Road, which is about 20 minutes away. And they recruit from Puerto Rico, all over the places. And the people that come up here, they love it, and they bring their families up here. So
This is what you have to say. You don't tell people you were transplanted. You were implanted in Minnesota from
yes,
Houston.
exactly.
What would, I'll ask Tanya, you said, if I was a 30-year-old dentist and I say, hey, I want to move to this area, where would I live? What would be some fun things I could do on the weekend?
Oh, hunting, fishing, four-wheeling, ATVing, sports.
What's a popular sports? What's the popular sport there? What's everyone's favorite sports team there?
Wow.
Hockey.
Hockey, yeah.
Hockey.
Hockey.
We're hosting the state baseball tournament this weekend.
That's big
That's-
for Roseau.
Yeah.
Yep.
I also talk about just be real, and I say this because I think it's important to always call out challenges, because we help people find associates in New York City, and we had 24 applicants for one job. What that meant was 23 dentists don't have a job. Then we go to Kansas or Minnesota or upstate New York, and we're striving to get people to understand the story. Maybe, Dr. Pham, why is there a lack of dentists in an area, right? Because in my town in New Jersey, there's one dentist for every 1,000 people, right? So while we are busy and while we are booked out, our patients have plenty of choices in the area. Is there not as many dentists moving into the area? Tell us about that.
We had 2 retire
Yeah, we had 2 retire.
that nobody took over their practices.
Yeah.
So you guys have real opportunity for growth then. If someone really comes and bonds with you, Dr. Pham, they could grow over time, and
Yes.
they could be an implanted dentist like you. So
Yes.
I love what you guys have shared here. People can text. I'm going to put MN to 215-798-9897. My team is watching in. They'll drop the link in the chat at dentistjobconnect.com. But I'm going to ask you guys to wrap up with this. Each of you get 30 seconds to tell the audience why they should come and work with you. I'm going to start with Kara.
Because we are super fun.
Super fun. I like that. Mary.
Excuse me, put on the spot. I'm actually new to the office. I used to be in radiology, and I did MRIs and CTs and was looking for a different change. And seriously, this office is absolutely fabulous. I love that there's windows. I love that there's
Cool.
such a great atmosphere, just everything about it. Even if we are short-staffed, I love coming to work every day.
I love
And
that.
if
That's
you're
an
an outdoor
awesome-
enthusiast, this is the place to live.
Yeah.
I'm an
outdoor
outdoor
enthusiasm
enthusiast
and
myself.
outdoor enthusiasm and enthusiasm inside the office. I love that.
Right.
Yeah.
Tanya, how about you?
Yeah. We're try to come to work every day, make the best of it, try to make our patients comfortable, even if they don't like the dentist,
Yes.
like to come visit us.
When people are, this is what I say when people act up in the chair, I just say, oh, I have a question. Do you like eating food? And they're like, yes, I love it. It goes, well, I'm just trying to help you do that. Could you calm down a little bit, right? So you can use that. And Dr. Pham, you talk dentist to dentist. If somebody was scrolling by their phone, stop and see us, talk to dentist about why they should at least get on a phone call with you, Zoom, to hear about this opportunity.
Well, like when Lady Gaga was starting out in her career, she said that she only needed one to say yes. So I just need one to say yes to me. And it's seriously, drama-free here. We work together, we communicate, and it's just a good working environment. It's a great place for a new dentist to grow and learn, because I'm not the type of dentist that's, you know, you're on your own type of thing. I mean, I'm there to help. I'm willing to give them as much as they want to take on, and I will do the hygiene because I know
I love
dentists don't like hygiene. So, I mean, I'm
I
willing
also
to
though say,
whatever
Dr.
to
Don't
make them
knock hygiene.
successful.
Nothing goes wrong during a hygiene appointment. Class 2, the thing, little ring thing flies across the room, the contact. Hygiene can be a very nice, I did hygiene when I started out because it was a nice way to meet the patients, but I think it's awesome that you do that. I wanted to highlight that, you know, we talk a lot about mentorship in dentistry, and you're a mentor in the next operatory. And there can be a lot of loneliness for new dentists. Dental schools do not give them the training that it gave us. They don't have the reps. So when you can walk into the next operatory and say, hey, Dr. Pham, is this implant impression coping right? Hey, Dr. Pham, my patient says I'm too young to be a dentist. They don't trust me. What should I do? It's great to have that by your side. So you guys are an awesome team. Stick around, but Nacho audience, check them out on dentistjobconnect.com. A fun and friendly team with Dr. Pham. Thanks so much, guys.
Thank
Thank
you.
you.
Bye.